And welcome back to ChatGPT versus ChatGP. I'm Dr. Tracy Parnell, and I'm a physician who practices restorative reproductive medicine.
I'm Carolyn. I'm a fertility awareness coach. So ChatGPT, let's see how you answer the question of the day. If I have infertility, can I restore my reproductive function? So ChatGPT says the treatment for infertility depends on the underlying cause.
I entirely agree with ChatGPT on this. This is actually key and essential to being able to restore your underlying infertility or subfertility to normal. So when we say restore, we mean it doesn't just bypass the problem. It actually fixes the problem or optimizes it and makes the underlying natural reproductive function so that actually have a normal functioning reproductive system.
If we go into what ChatGPT suggests further, it's saying common treatments include medications that stimulate ovulation. What do you think, Dr. Parnell?
Absolutely. So one of the problems that can contribute to subfertility or problems conceiving is the fact that a woman doesn't ovulate or doesn't ovulate properly. There are a pile of ovulatory dysfunctions that can actually happen. And they either have that or they have a perfectly normal, healthy ovulatory release. We'll talk about that soon. What is optimal ovulation and how do you measure it? Because it's not just you ovulate or you don't. There's a bunch of this spectrum of how well you ovulate. And in restorative reproductive medicine, having a healthy, normal, regular ovulation is a really important aspect of that. And in certain circumstances and certain diagnoses, that medication is needed to stimulate ovulation. And when we use in RM, restorative reproductive medicine, we are aiming for normal ovulation, not hyperstimulation, not hyperovulation, releasing a bunch of eggs, but just like we do naturally, releasing one healthy egg. Times two, but mostly one. And that's really important. It's normalizing the reproductive system.
So it's like nudging ovulation induction as
Correct.
opposed to stampede.
That's a really good way of saying it. Absolutely.
From there, ChatGPT is jumping into intrauterine insemination or in vitro fertilization as restoring reproductive function. What do you think about those?
Well, in this way, I do disagree with ChatGPT. These do not restore anything. Yes, they are very effective tools for helping produce a baby, but they do not restore reproductive function at all. They bypass the problem. They are very common and they're relatively effective, but it doesn't impact your cycle. In fact, depending on how the stimulation is done, it may lead to more challenges for the woman. It doesn't impact sperm or semen count for the most part. And it's really important that if we're focusing on restoring reproductive function, we focus on identifying and fixing the underlying problem, restoring normal, healthy ovulation, normal, healthy semen parameters so that you don't have to rely on bypassing technologies like intrauterine insemination or in vitro fertilization or EXE, which is intracytoplasmic insemination, where they take a piece of sperm and they put it in the egg. These, again, are tools, but they don't fix the problem.
And it makes you dependent. Also, I think as you're building your family out, if you want more than one child, you're dependent on that underlying technology instead of having your function restored and being able to build your family fully. Your funds actually would set the level of the number of children you could have or the size of your family.
Absolutely. And it doesn't also address underlying issues that can actually lead to challenging and very difficult pregnancies. And we do know that prenatal outcomes in IVF are more challenging than women who don't have to use that technology to conceive. And there are a variety of reasons why. One of them is that the underlying problem that resulted in the fertility problem to begin with still exists.
Yeah. The next thing ChatGPT goes through is to consult with a healthcare provider, someone who specializes in infertility, and that they're the ones who are going to set the course of treatment for the specific situation. And I think you would probably agree with this as a physician. What do you say?
Absolutely. I think that it's important to see somebody with expertise. Physicians who practice restorative reproductive medicine certainly have a different focus than our colleagues who practice gynecologic or reproductive medicine in a different way. But either way, if there's an issue, the healthcare system should be helping you, not making you wait, helping you from the first moment that this is a concern.
One interesting thing is ChatGPT suggests a number of good articles to go through and read, and I can give those links below to the people watching. But one thing they get into is sperm concentration as a treatment. So, talking about the male side of infertility, that's something we haven't talked about already. But is there a way to restore male function in infertility?
I would have to say that restorative andrology, which is an approach that focuses exclusively for men in helping them restore semen parameters and natural sperm production, is still quite in its infancy. However, that being the case, there have been a lot of success with targeting why is there an underlying issue. And same as with women, there are more research papers, and perhaps Carolyn, you can publish these in the bottom, that also suggests that men who have abnormal semen analysis, it's not just they have problems conceiving, they have other health issues disproportionate to men who don't have abnormal semen analyses. So it is a marker of health concerns. And when we just bypass the problem, we're missing the opportunity to intervene for these people and for helping them figure out what's wrong and correcting it to avoid other health complications. Important. Simple answer, yes, there are restorative treatments. And as we develop more research, there will be more restorative treatments for men as well as women.
I think Dr. Purnell will have to go into that one completely on its own because
I
that's
agree.
a topic on its own. So
I
if you
agree.
other links, if you have another few minutes, one is from Alberta Health.
Treatments that bypass the system are definitely stressful and costly. Obviously, anytime you have a health problem, it's stress. Working with a healthcare team that can help you understand and support you to come up with a treatment plan that you can implement to improve your health definitely reduces that stress factor. Cost interventions like artificial or intrauterine insemination or IVF or ICSI they're costly procedures. When you're talking a restorative approach, we actually really spend a lot of time talking about stress, its impact on the hormone cycles in men and women, and really working with a team to help reduce the stress that all of these health issues cause. And in that way, allowing the patient to optimize not only their health, the management of stress, but obviously their reproductive cycles as well.
There's a few more topics ChatGPT gets into, like planning the topics that you should bring to your doctor's appointment.
Always smart. Yeah. I really think that no matter what route you're using or what doctor you're seeing, you should have a map of all the questions you want answered so that when you leave the appointment, you have a good understanding of the physician and the clinic's approach to your particular situation.
Dr. Purnell, I can already tell that's going to be another topic that we do.
It is.
The last thing I want to get into is the medical that ChatGPT says that medical history, physical exam, and tests will actually determine infertility.
They help determine the cause of some of infertility, and terminology is always a little difficult. So subfertility means infertility that can be treated. Infertility technically means can never conceive or aren't conceiving. However, yes, medical history, physical exams, and tests can be done in a way that provides information, but it has to take into account the fact that women are having cycles. And if you do a blood test at a time that doesn't reflect what time the woman's cycle is in, then you really can't interpret the blood tests. So history and physical tests do need to be done individualized to the patient. And in the same way, testing needs to be individualized and tied to a woman's individual cycles so that we actually have an accurate representation of what's happening.
I just wanted to pop in here as a fertility awareness instructor that there's a way to tap that knowledge and get that kind of training. And there's lots of modalities to do it. And again, we talk about all of them on this program. Before I leave, there's a study I wanted to bring in. ChatGPT was very thin on the studies, but I did not specifically ask for them. But I was looking based on its warnings about cost and the stress that these kind of modalities cause, that many people do not seek help when they actually have infertility. The study I'm citing is from the European Union, actually from Britain, and it's 15,000 participant wide study. And they found that just over 50% of people with an infertile diagnosis actually sought help after that. And I'm just wondering if you think that's reflected here in North America, especially in Canada, where you practice.
I think that those numbers are probably higher than we might see, and certainly higher than in the United States. Part of that is simply the treatments that are being offered are expensive and generally not funded by the system. In the UK, they do have access to IVF and through certain mechanisms. So it is publicly available. So I think people are more willing to take the chance. That's really their only option in many cases that they're given. So it really does depend on what resources and funds are available. But you have to wonder sometimes, are we limiting people's choices to have their family because we're really only giving them the choice of very expensive, very invasive medical tests or medical interventions that a lot of people really just don't want to go that way. So that's one of the things that's really interesting and exciting about restorative reproductive medicine is amazing examples of heartbreaking stories that have really successful outcomes. And so I can provide a case, a published case. And I know, Karen, that you have some of the studies that we've been involved with in the link. But this is a case in a medical journal where a couple had 16 years of infertility. They had experienced 3 recurrent miscarriages, 8 unsuccessful embryo transfers with IVS. And my colleague, Dr. Boyle in Europe, saw them. And they went through all the treatments available to them in the traditional system. And then they sought restorative reproductive medicine and were able to identify what was the underlying issue, have treatment. And in the end, she had a full term, healthy singleton pregnancy, which is just amazing. But this is the focus of restorative reproductive medicine. It's not just bypassing the problem, it's finding the problem, addressing it, restoring natural reproductive function. And then these patients are able to, because the underlying problem is fixed, they can not only conceive, but have healthy pregnancies. And that's really what we want is we want a healthy mother, healthy babies, healthy families. And that is the benefit, the excitement that I experience as a reproductive medicine physician. So hopefully that's something that we'll be able to help patients access in a more effective manner and provide more choices for women and couples.
That's what I'm really excited about, is helping more people restore their reproductive function through these
Absolutely.
outcomes and these services, and making sure that they're accessible for people. I'm going to post that study and the other one on access from Britain below, as well as some of the other sites that ChatGPT sent me to, which kind of lean towards non-restorative, more IVF based. And you can decide. Join us back next week. We're going to do this once a week. And if you have any questions that you want us to ask ChatGPT, and then we'll get our doctor to bounce her expertise off of it and fill in some of the blanks that ChatGPT leaves. There is a link below where you can fill in a survey and ask those questions, and we'll try to get them on the program. Thank you very much.
Thanks, Carolyn.